One of the hardest parts about being a nurse is, of course, learning. Okay, learning terminology, learning the different parts of the body, also the long hours. You're lucky if you can find an 8 hour shift, but most times you're working 12 to 16-hour shifts, and sometimes they can be back to back, and that can take a toll. Another part of being a nurse that is difficult is the emotional toll. Dealing with patients and witnessing them die after you've worked so hard to try to keep them alive and help them survive is very difficult, especially if you've had a patient for weeks or months and then they die, because sometimes you have attachment that you have with the patient. You get to know them, the personality, their family if they come and visit, and so it comes like a becomes an extended family sometimes the longer you have a patient. My favorite part about my job is meeting the new people, learning about new medicines or new techniques for treatment. Something that I learned while being a nurse, I've learned that nurses walk a marathon. We are always on the move. We're always walking up and down the stairs, back and forth on the ward or on the floor, to the lab or any other place that we need to go and get information and can't wait for it to come through the chain. We are always on the go, moving, moving, moving. I also learned not to make assumptions about the treatment or about what's going on with the patient. I learned to listen to the patient, okay? Showing empathy for how a patient feels and what they're going through is some of the best treatment. Just to feel that someone is listening to them and trying and concerned about how they feel and trying to make them feel better makes them feel better. So I hope this helps.